Community Level Social Determinants of Health Challenge. My name is Jaime Elliott from CAPCON Consulting, and I'm now going to turn the webinar over to Jaime Zimmerman, Senior Program Advisor in the Office of the Director at AHRQ. Jaime?
Hi all, welcome. Thank you so much for joining us. I sit here in the Office of the Director on behalf of Mr. Gopal Khanna, our Director. He has really been pushing AHRQ to think about how we can better do our work to better meet our customer needs. And he's really challenged us to think about how we can think about our work in the context of what's happening in the digitization of the world and how we can make our products better. And so we are really excited to be launching or be part of, this is one of three other challenges that we're doing, and the benefits of this public-private partnership we are really excited about, and we really look forward to all the applications that come in. And so with that, I'm going to introduce my colleague who's been helping to lead this Social Determinants of Health Challenge competition with me. She is also the Senior Advisor for Women's Health and Gender Research within the Division of Priority Populations Research here at the Agency for Healthcare Research and Quality. And I'll turn it over to Dr. Camille Fabiyi.
Good afternoon. Thank you for joining us for today's webinar. On the screen, you'll see today's agenda, what we plan to discuss, including the challenge purpose. I'll be providing an overview of the challenge purpose, the timeline, prize structure, data resources, submission requirements, review criteria, and then I will be turning the presentation over to our colleagues at Capital, who will provide more information on the registration process, and then we will move forward into the question and answer portion of the webinar. Next slide, please. So AHRQ's mission is to produce evidence to make healthcare safer, higher quality, more accessible, equitable, and affordable, and to work with the Department of Health and Human Services to make sure that the evidence is understood and used. So in keeping with that mission and also our aim of helping healthcare systems deliver care that is high quality, safe, and high value, AHRQ has launched this challenge, which seeks to better understand unmet health service delivery needs in communities and to develop ways to identify and predict those needs at the population level. The reason why AHRQ is pursuing this challenge is because information to support decision-making about how to provide the quality healthcare to populations within the context of the community is incomplete. And evidence has suggested that using data on social determinants of health and community services may help AHRQ and others better plan for the use of limited resources, improve population health outcomes, and drive savings. Next slide, please. This challenge is structured in two phases. In phase one, which has already begun, participants will submit concept abstracts and prototype designs of data visualization methods through June 7th. At the end of phase one, up to 12 semifinalists will receive $10,000 each based on the merits of their proposals. Beginning in late June, we will kick off phase two, and those semifinalists will develop proofs of concept, which will be judged by an expert panel. One grand prize winner will win $50,000. Up to $35,000 will be awarded to the second place winner, and up to $15,000 will be awarded to the third place winner based on the performance of their visualization tools. Next slide, please. Submissions must include free, publicly available social determinants of health data to design visualization tools that can augment insights drawn from analyzing medical expenditure and healthcare utilization data at the community level. Examples of data sources are shown on this slide, and a website link is provided here for further exploration of these data sources. Next slide, please. In phase one, participants should present plans and a prototype of their visualization tool. Abstracts of the proposed solution should be no more than 3 pages and include the submission requirements that are shown on this slide. The requirements include providing a detailed overview of the problem, a statement of 2 to 3 specific health services research questions that can be informed by the submitted data visualization tool, no more than 2 static images of the concept described in the narrative, and then detailed information about the sources of data. Again, participants should use 3 or more data sources that from federal or state databases or local data such as voice, digital, or social medical requests via service lines. And we also want to see currency and range of the data described in the abstract, as well as the platform that's used to build the tool, and then the description of the statistical methods that are used in the development of the tool, particularly explaining how the tool will be hosted, shared, maintained, and made publicly available as fully developed. Next slide, please. Other submission requirements are shown on this slide and include a description of any additional reports and data sources that reviewers can use to affirm its accuracy, a description of the plan to fully develop the tool, a description of the target audience of the tool and the perceived benefit that they will receive by using it, as well as how it will be promoted to maintain and solicit new engagement. A submission that uses graphic design and visualization best practices. And participants also have the option of supplementing their application with a short video submission. Again, that's an option. And then we also would like to see plans for the integration and scalability of the tool in the second phase. Next slide, please. The challenge submissions will be reviewed by a committee of experts with the requisite competencies, and those advisors will use a Likert-type scale to assign numeric ratings in 5 overarching categories, which include data, innovation, tools, insight, and implementation. Each category will be equally weighted, and the review criteria are described here. Beginning with the first category of data, we want to see how well participants integrate social determinants of health domains into the tool, the security and repeatability of their data retrieval method, logic of how the data was integrated for the analysis, as well as dimensionality of the analysis. Under innovation, we want to see the reviewers will be judging based on how innovative, the most innovative capabilities in the solution for displaying and understanding the data. Moving forward to the next category, review criteria category of tool. Reviewers will be reviewing how well the tool is designed, including its ease of use and complexity, the reliability of the tool, particularly which speaks to any underlying data that's being obtained from a reliable source about the tool, public availability of the tool, use of best practices and methodology for combining information, fidelity and the participants' use of the data, repeatability of the solution, which refers to AHRQ being able to track back the work and understand the methods that went into producing the solution, how well the tool can be shared, but can be used by AHRQ to identify and understand the downstream implications on the outcomes that AHRQ measures, such as unmet healthcare needs, healthcare costs, and healthcare utilization, and then as well as the availability of the open source version of the tool. And finally, the last 2 review criteria categories are shown here, which include insight and implementation. And the sub-criteria under insight that will be judged include how well the participant demonstrates an understanding of their communities that their tool addresses, and describes how well their tool will blend into AHRQ's planning process, how innovative is the tool in its use of the data, and how well the tool and its data help tell a story. With regard to implementation category, reviewers will be judging how effective the participant statement and understanding of AHRQ's application is for health services, as well as the participants how well the participant understands the problem these tools aim to solve and the impact that it will have. So that concludes my portion. I will now turn it over to Capital to describe the registration process in more detail.
Sure. Thank you, Camille. Hi, everyone. When you go to the website, and the link to the website is in this deck, and I believe most of you have been to the website as you have ended up here. When you go to the submission requirements page, you will see the link to the registration system. When you enter that, this is the page that you will see. This is the first part of the registration page. We collect general information about you and your submission here. These are required by the Competes Act, and essentially you are submitting as an individual or as an organization. And as noted in the submission requirements, if you're submitting as an individual, you must be, or that individual must be, a U.S. citizen. If submitting as an organization, you must be an organization with an entity or with a location based in the United States. And then you can see at the bottom there is where we start to get into more project-specific, number 14, project-specific data gathering, which is your project title. Next slide, please. So as Camille mentioned, you can upload a video. So for instance, you may upload that video to YouTube and make it listed as private so that anybody with the link can view that video. If you choose to make it public, of course, you can do that as well. And then you copy that URL and paste it here. And then the last two, 16 and 17 here, are noting that you have reviewed, understand, and agree to the submission requirements and that you are, and the eligibility criteria for this challenge. Next slide, please. After you fill out the form and click Next, you will have sort of a review and submit page that just captures all of your information and makes sure that you are ready to submit and that you don't need to go back and edit anything before submitting. Next slide, please. So once you submit, so you may have submitted that optional video link there, but you have, at this point, you have not submitted your actual file for your 3-page write-up for inclusion. So once you submit and have registered, on the right-hand side of your screen toward the top, you will see a Documents tab, and this is where you can go in to submit your paper. So next slide, please. And once you click that Document tab, you will have a simple Add Document button there where you can upload your submission. And with that, I will turn it back over to Camille, or I guess to Jen for any Q&A. So there is a Q&A panel in the bottom right of your WebEx window where you can submit questions, and we will read them out and get answers to them. But at any time during the open period of the challenge, you can email questions to the email address shown there on the screen. So Jen, do we have any questions yet?
Hi, Jaime. We just have one question right now, and it's, is there documentation on AHRQ's planning process that you hope this tool will inform?
Okay. I think I would ask either Jaime, Mamatha, or Camille to field that one.
Good question. So the answer to that question is that currently we don't have that information available. AHRQ is currently in the exploratory phase of this work, and we're wanting to see, we're hoping that the challenge will inform the exploratory work that AHRQ is doing in this realm right now.
Great, thank you. I have another question. Are groups at a university eligible?
Yes. It can be individuals or groups.
Okay. Can you define what is considered public data? Anything accessible online?
From AHRQ's perspective, public data is anything that's accessible to AHRQ or to any other potential applicants. Generally, public use data is available on websites or can be secured via an open process. We are not looking for anything that's proprietary because it needs to be shared, at least with AHRQ, so that we can actually assess that quality, the quality of that data as we look to apply the criteria for this challenge.
Okay. Do you have an example of a similar tool to what you are looking for?
AHRQ does not. However, there are, to our knowledge, other entities out there in the, I guess in the data space that have their own type of visualization products that are used by entities, national entities like, for example, the Commonwealth or the RWJ Foundation. There are several other organizations out there that do display information of this type visually.
Are there restrictions, WRT, number of screens, etc.? For example, do you allow multi-screen visualizations?
Yes.
Is the tool specifically refers to a web application?
At this point, no. I think at this phase of this process, we're looking to many different mediums. A web-based one is certainly acceptable, but not the only one.
Are there any specific requirements on the fidelity or sophistication of the prototype?
I'm sorry, can you repeat that question?
Sure. Are there any specific requirements on the fidelity or sophistication of the prototype?
I think we're looking for prototypes that leverage technology and are as innovative as possible. I think we are open to many different models. The only real requirement here is that it be non-proprietary and, in essence, not a black box.
Who is the intended audience of the tool? Is it AHRQ researchers, university researchers, industry, other, or all of the above?
All of the above. We hope that the information that comes out of this challenge will help policymakers, public health officials, researchers, advocates, providers of social services, and others better address community health challenges.
Do you have some past examples of what these look like?
Again, I'll just reiterate that there are examples out there in the field that one could reference. For example, the Robert Wood Johnson Foundation, the Commonwealth Fund. I think there are several others, but I'm sure that is something that as you all look to gaining information and exploring other data sources, that you may find others as well.
The requirement to make everything public domain, including all source code, are usually stringent. What is the reason for this?
So as a federal entity, we tend to shy away from things that are proprietary in nature because we are committed to an open access, transparent set of products. Long term, we certainly appreciate that folks on this challenge may have concerns about that, and we're certainly sensitive to that. But for this particular challenge, we are committed to open data, open source, and transparency.
The first phase funding, $12,000, is to fund the development of the prototype. The winner then gets more money when phase two is announced. And what is the phase 2 money for?
Hi, this is Jaime. If I may respond to that. The money works differently than grants. The money that is received is prize money for the phase 1, so being the best of the prototypes. So it is not necessarily money to fund the coming development or the next phase, even though it could appear that way. But it is somewhat of a reverse grant.
Okay, those organizations you mentioned have a lot of programs and tools. Can you please point us to the specific tools you are referring to?
I don't think it's in the best interest of the challenge participants to start from that point. We're looking for innovation and creativity. So to the extent that applicants search the web and get ideas, that's great. But the whole point of this challenge is to start from a place of independent and creativity. You can certainly go look at examples, but we're looking for we're not looking to replicate what's already out there. We're looking to create something new and really leverage technology and innovation in a way that perhaps AHRQ is not aware of.
Okay. What is the geographic scope of the submitted application? U.S. only, state level, county based?
All of the above, and the smaller that they can get, the better. In terms of national, state, community, all of the above.
What forms are you expecting for the visualization prototype? I understand the video can be used for this, but what could we submit? Web-based prototypes? Can static images be submitted with the proposal?
Yes, static images can be shared with the submission. Up to 2, I believe, static images is what we specified in the submission. Yes, no more than 2 static images of the concept should be described in the narrative.
The NASA Tournament Lab conducts high-quality crowdsourcing competitions through companies that already have hundreds of thousands of competitors. Will the competition ever be presented through a professional crowdsourcing platform?
To date, we have no current plans to do so. Having said that, I actually can't predict the future, and so we will leave that as a possibility for the future.
Does the prototype need to be functional, or can it be a wireframe?
I think we are open to either. I think the point of the prototype is to demonstrate the innovation and the creativity in whichever of those 2 formats is most feasible.
How is this challenge different from the current AHRQ grant that calls for data analytics to support primary care and community interventions to improve chronic disease prevention and population health management?
So thank you for acknowledging the other challenge. We had a very well-attended webinar yesterday.
The grant.
Oh, sorry, the grant. The grant announcement. So that grant announcement is really to also establish a data infrastructure mechanism around social determinants of health for the long term. This is really to focus on specific data sets and data that are currently available out there that AHRQ may or may not be aware of, that we can start thinking about how to leverage and connect up with AHRQ's long-term goals in this social determinants of health space. We also are looking for creativity in how data is displayed. So data visualization is the key component of this. And we're looking to folks out there in the field who are much more closer to technology, and recent advances in graphical displays to bring that forward in using social determinants of health data.
What is the restriction on the video submission, total time of video, etc.?
Hi, this is Jamie. The total time is 3 minutes, around 3 minutes, or less than 3 minutes, and that it must be uploaded to a web format. So it's video uploads would not be accepted in the Files tab. They just need to be posted somewhere online, and then the URL provided to the video.
If one has a novel approach but isn't willing to make all source code public, does AHRQ have another SDOH initiative that is more suitable?
Currently, this is the only challenge related to social determinants of health that is in the works. I really cannot predict whether there will be subsequent opportunities to do so.
Okay. On the one hand, the challenge refers to a visualization tool, but you also refer to statistical methods, which suggest that you expect some sort of analytics to be done. How important is it for the submission that we generate new insights with the tool?
It's important that from a data visualization standpoint, you are bringing together various pieces of social determinants of health, not just one social determinant of health factor. In terms of how complicated your analytics are, for instance, bringing 3 or 4 factors together, that's entirely up to you. You can go back to the review criteria about how that's assessed. But the point is to use the data visualization techniques to draw out more than just emphasizing one social determinant of health factor.
Okay, that's all the questions I have right now.
Okay, thank you all for joining. We look forward to all of your applications, and if you have any questions, please visit us on our website. We have an email box, challenge@ahrq.gov, I think. Thank you so much, and thanks to our colleagues at Capitol for helping lead this presentation.